Welcome everyone to the Greater Purpose Health and Fitness Podcast. Today, I'm very excited to have Dr. Louis Minders on our show. I think this is our 14th or 13th episode. I should have wrote that down, but around there. Louis is the hospitalist or also known as inpatient care physician at the St. Mary's Hospital in Camrose, Alberta. And Louis has also been CrossFitting for 2 years at CrossFit Camrose, also known Greater Purpose. So that's the umbrella name. Road bike. He was a road biker in South Africa, food and wine enthusiast, fantastic baker. I've got to experience it. And also pizza. So you guys know, Julissa and myself love pizza, and Louis makes amazing pizzas. Just have to put that out there. Welcome to the show, Louis.
Thanks so much. Yeah, it's really nice to meet with you like this. And yeah, I'm excited about what we're going to talk about today.
Yeah. So today we're going to talk about the Greater Purpose Health and Fitness Flywheel and how it connects, it's closely connected to Bluezones. So Bluezones are places in the world. Now I have to make sure I say this word right. It has the highest per capita of centenarians.
Yep.
Perfect. I was like, okay, because I said it wrong a couple times before, but centenarians, and it's based around this holistic, healthy and fit lifestyle. So it's not just that they live in particularly pretty amazing parts in the world, but it's also the culture, the community, the faith aspect, the food. So that's what we're going to be diving into today. And I have a list of Bluezones here that I pulled off of Google, and there's 5. And I don't know if it would have changed, because as I was reading it, I was thinking, well, if it's per capita centenarians, it's going to take a while for this to be updated.
Yeah, I think who knows what has happened to them during COVID, right?
Yeah.
Especially because a lot of the lifestyle things would have been affected by it. So I'm quite intrigued to see what's going to come like 20, 30 years from where we are now, to see if, there's been a massive change in what that is.
Yeah. And you mentioned 20, 30 years from now. I think that's important to note, is that we probably won't see the effects for a long time, right?
Mm-hmm. Yeah, I mean, there'll be several waves. I mean, we're seeing changes now. We'll likely see changes in 5 to 10 years time. There'll be a 10 to 20 year change, but yeah, I mean, this could have really changed their entire way of life.
Yeah, and particularly, let's kind of talk about, the health and fitness flywheel at Greater Purpose is spiritual, physical, mental, purpose, connection, and there's always one more, I think. Or is that 5?
That was 5, I think.
Yeah, it is 5. It's just,
you got it all.
easy. Yes, good. And I actually know in the Bluezones they have 9, but they kind of all play on each other. Now you're mentioning that this might affect some of that. So which things are you seeing that it might affect in these areas of the world?
Well, I think the social aspect of it, the fact that they all live in a community type environment where they're constantly interacting with other people, that whole thing of going outside, being outside a lot, buying this item from this person, not just sort of going down to Superstore and using the self-checkout, but actually speaking to the people and having a relationship with a guy that you buy bread from, right?
Yeah.
So that's a big part of it. And I think the faith-based community aspect of it that they seem to all share is likely going to take a bit of a knock too. And then having a multi-generational household. I mean, now we're in a position where we're trying to split ourselves off, and we really don't want to see anyone who's above the age of 75. But here, the whole thing is that you have from age 5 months to 105 all in one household. And that's not really something that will necessarily hold true here. We'll just have to see.
Yeah, it's really tough because it's not like it hasn't been a really sharp, acute change, right? It's taken time for us to kind of get away from these roots of community and relationships, because you touched on relationships, and I think that is huge, and the community aspect is huge. So we're a brick and mortar gym. We've pivoted, just like a lot of gyms have to do, online. But honestly, the biggest aspect I see, and it's become really apparent to me and other people, is that it's about the connection. It's about the community. But you can get free workouts anywhere, right? But it's about that coaching aspect and that one-on-one relationship, and also the community aspect too.
Yeah, no, it's very, very true. And I think as we're able to come back, we'll suddenly realize how crucial it was. I think everyone woke up some mornings thinking, oh, if I could just do this at home. And yeah, there were days that I was like, oh, great, thank goodness I don't have to drive anywhere.
Yeah.
But you suddenly walk in again and you start seeing people and you realize that this was what it was all about. And don't get me wrong, I'm very, very fortunate in my work that I work in a healthcare team. I work with people the whole day. And without that, I think I'd be much more stuck. I'm one of those extroverted introverts. I'll have everyone over, but not say anything. So working in a team like that has really saved me. So I think we need to recognize that for some people, you are the team, and you're sometimes the only team that they find meaning in. And there's one of those balances of, yes, we need the things that we're doing right now, and it's clearly working because numbers wise, everything's going down, but you are sacrificing something. And the reality is that we're sacrificing that sense of belonging to a group purpose.
Yeah, I think that's well said, is that we try so hard to be able to control every aspect of something, right? Like we can't. And like you mentioned about the community and the relationship thing, I think that's really, really huge. And the reason we don't see it or don't acknowledge it as much, I think, is because, like you mentioned before, it's going to take a while to notice these negative side effects. We're a society that's very instant gratification based, right? We don't often think about, we don't have foresight to think, okay, what if we do this, what's it going to do down the road? And this isn't just talking about the time we're in now, but as individuals too, right? Like taking 5 minutes.
It's basically the basic principle of every single chronic disease process. You have to do something now to affect something later on. And everything is about diets and seeing weight loss and seeing change now and trying to get to a specific size or a specific weight. But it's actually bigger than that. It's about 20, 30 years from now, like where you actually going to be. And if you don't consider the changes that you're making now in a long run kind of way, you're going to miss the point. And it goes back to the whole Bluezone thing. One of the things is they live in these multi-generational families, and the habits that the older people have rub off on those that live with them. And in healthcare, you do tend to see unhealthy families. You see diabetic families. And yes, that has in part to do with their actual gene makeup.
Right.
But a lot of it is to do with lifestyle, because families live in a very, very similar way. And so if you join a group that lives in a different way, that has a different value set, that gets you moving, you're aligning yourself with a different 20 to 30 years from now.
Yeah, there's a lot to unpack in there. And something I never really thought about is the passing down of habits, which is very cultural based, right? Like we are so connected, yet so absolutely disconnected right now. Like we can message instantly. Obviously, we can do this over Zoom. I can talk to someone from around the world, but it doesn't make up for being in close proximity with like someone who, like you said, 5 years old to 105-year-old. Like there's so much wisdom and culture in being close to someone who's been through all this, right? They've seen all this. And with this disconnect, we're getting further away from what actually makes us human. And then you can probably attest to this. Like you will see in the healthcare system the negative side effects of someone not prioritizing this stuff. And I'm sure that can be frustrating at times for you and hard because uh, medical professionals often get looked at as fix me, right?
Yeah.
And do you want to speak a little bit on that? And
Yeah, there's definitely a culture shift happening in medicine as a whole, where it is all about ratings and feedback, and it's become like a service where you have an expected outcome, and if that outcome's not met, the service is no good, despite the fact that the outcome you're hoping for is maybe not something that's feasible. But as you say, there's this whole, I go to Costco and I need to get this thing returned, fixed, and they say yes. You come to a healthcare facility, fix my 89-year-old sort of grandmother.
yeah,
The expectation is that there is an instant fix, but there's a whole lot of things that have happened and that's changed in what's possible. It's just really, really difficult to navigate that. But yeah, you have people with lung problems, diabetic feet, that, and unfortunately there is this fix me attitude, but there's a whole lifestyle, and I think the general practitioners working in the sort of community-based practices are going to be more exposed to this, because I see people at the end of the line
right,
when things have gone really, really bad. I tend to say I'm the guy that you never want to see, because it means that something is very, very wrong.
right,
But if you talk about preventative medicine, the reluctance for people to engage in something that will prevent them from being sick. So at an annual physical, if you say, well, you're overweight, your HbA1c is in the pre-diabetic range, you're hypertensive, you need to make a drastic lifestyle change. There's an inertia to try and change those things because it's a whole lifestyle change. Isn't there something that we can do to quickly fix it? And what you'll sometimes see is an improvement in 3 to 6 months, and then people bounce back because they embarked on it for the sake of the sort of numbers. I want good numbers, but there's no appreciation for the long term.
yeah. It's attacking the symptoms, right?
Mm-hmm. Mm-hmm.
We, and I think we've chatted about this. Like I picture it like there's this big ugly thing, like let's call it an octopus, right? Like we just start cutting off its tentacles and saying like, this is the problem, I need to fix this. And then
Mm-hmm.
once I get this sort of medication or this surgery or whatever else, it's done. But then we don't understand that there's a body to this thing, right? That has built and built and built over time. And there is no shortcuts. Like you can't sneak past it. And that's really hard. Um, because you want to be sympathetic to the difficulty of changing a lifestyle holistically. Like it's really, really hard. It's hard to say someone comes in both our professions and they're in a position where it's accumulated over years and years and they're got chronic disease, they have a bunch of pain, and literally we know that small habits over time will build and change, but we want the instant thing. We want to say like, no, give me this pill so I can lose all this weight. Because when I lose all this weight, then I'll be here. But in reality, it's a byproduct. Weight loss, lower body fat percentage, glucose levels, I'm sure. Like it's all a byproduct of the whole.
Yeah. And I think the absolute poster child for this, and I know we're veering horribly off topic here,
All
but
good.
it's my one moment to have a complete soapbox moment
Yeah,
is
let's
lower
do it.
back pain.
Okay. Yeah.
Lower back pain. And I'm sure you hear about it a hell of a lot.
Yeah.
But there was a recent CMAJ article, the Canadian Medical Journal. They looked at what interventions actually help chronic lower back pain. And do you know what the only thing is that helps chronic lower back pain?
Is it exercise?
Exercise. Yes. But everyone wants to be fixed. And it's this, I need an injection, or I need surgery, or I need an MRI. But the fact of the matter is, the lower back pain is a symptom of a bigger problem.
Right.
And it's exactly as you say, it's that octopus foot, leg, tentacle that you can cut off.
Yeah.
We can inject it, you can manipulate it, we can do an MRI and go, oh, there's a disc bulge there. But nothing's gonna fix it.
Yeah.
You need to do a bit of work on it, and start moving and start doing things. And I think that's the big mistake people make with a lot of injuries. Yes, there are things that you have to rest and things like that. But like with my shoulder that I saw you, the big thing was moving it. The big thing is I wouldn't be 12 weeks down with full shoulder range of motion if I didn't work on it, and if we didn't work on strengthening everything that goes with it. Yeah.
Well, and like, again, it's okay if we get off topic because this is what it's about, getting off topic in good ways. But you mentioned that we work together with your shoulder. I worked together with your mother-in-law with her back and her knee. And for myself, major back injury. But I'll touch a little bit on that after. But it took you knowing that you have to keep moving, right? So we just did a testing day last week with you. You were unable to move your arm to full range of motion without pain, without pressing overhead. So we just started with really light presses. And then in the meantime, we still worked on other aspects of your body, right? Like studies have shown that actually helps increase blood flow to the actual injured area too, right? We're not just made to stop all physical activity, depending on what it is. Mm-hmm. And sometimes it might need an acute intervention. Like there might need to be surgery on someone's back because it's gotten that bad or it's that traumatic, but that's not fixing it, right? Like you still have to go back and change these habits that have formulated into this chronic pain or chronic disease. So for myself, I didn't have a coach, worked out lots, 2 hours plus a day, wanted to be like the professional CrossFitters. There was not one instant that happened. I think it's just an accumulation of poor form, because that's another soapbox moment is if you lift poorly once, if you've developed capacity, you're going to be fine, right? Don't do it over and over and over again. But anyway, hurt my back, couldn't bend past my knees, 3, 4, 5 years, then a hip injury. And then I started to search out medical professionals, and I was told to have surgery, and I was young, so I didn't want to do that. So I started to look around and look for different people doing things differently. And that's where movement resolution stem from, is this idea that not everything needs an acute fix. Some things will 100% if they get that drastic, but I can safely say that I am pain-free now. And I was told to have surgery and become an endurance runner. And if you guys know who I am not an endurance athlete. But that's too much about me. I got on the soapbox with you because we need to empower people to take ownership and give them the tools but then they also have the ability to accept what the tools are. Like it's slow,
Yeah.
consistent strengthening and good nutrition, connection, and the blue zone stuff.
Yeah. Yeah. And it's hard work. And if you think about these people's lifestyles that get them to 100,
Yeah.
0.1 of the 9 power items, or whatever you want to call them, is move naturally.
Mm.
They're constantly outdoors. They're working with their sort of physical bodies. They're walking, they're fixing things. It's this constant movement that gets them to that age. And it's something that you're constantly saying as well. Get outside. I know it's cold, but go for a walk. And it's that people definitely lack, is it's this whole sedentary lifestyle of being seated the whole time. That's not good for us. It's not what we're made to do.
Yeah. And you touched on something there too, is it's everything combined. Like the flywheel is separate compartments, but if you go outside, there's a spiritual aspect to that too, right? There's a purpose aspect to that too. It takes you away from all these acute stresses and pains. So we are constantly in a search of the next best method or diet or exercise, when in
Yeah.
reality, it's all of it. It's just start and do it, and stop worrying so much about waiting for the perfect pill. Because you just see what other people have been doing, like in the blue zones.
Yeah.
There's a reason it's worked there. It's a reason it's there.
Yeah. Yeah. And it's not just about movement. It's that general uh, appreciation of what you feel yourself with as well, and whether that is feeling yourself intellectually, feeling yourself spiritually, taking that time to meditate, taking the time to be calm, which is another thing that they all share. But it's also about feeling yourself physically and looking at the actual food that you put into you. And it's really scary to see what people feel themselves with. Um, and and this is the one part that I get very, very excited about, because I
Yeah.
love food. I love food, but I love controlling what's in my food, and I think that's why I love making food. That's why I bake my own sourdough, is because I'm controlling what's going into it. And it's it's really, really special to see something that you've made make other people happy, firstly, but also it, on a very primal level, you're sort of nourishing your entire family or those
Yep.
around you.
Well, and you touched on purpose and in there too, right? Like food made with purpose. I think we demonize a lot of food, um, making it feel like that's the exact thing that's causing everything. It could. Like, I mean, our society is, we are heavily carb based, right? Carb based and sugar based, which plays a lot of problems. But if we enjoy it in moderation and actually prepped it ourselves and all these other things that play a huge role into it. So to just say this is the one thing that's causing it is really hard to say. And this is where it gets really confusing for people, right? Because we're exposed to all this media and all these different tactics and saying this is the best thing to do, this is the worst thing to do. Um, how do we get through that? How do we change the
Yeah,
conversation?
I I think every diet out there is going to work for a period of time. There's they they did a trial where they looked at the 5 most common diets, and they sort of tracked them over time. And at the 1 year mark, the sort of weight loss and everything was fairly similar, but those that were really, really restrictive tended to peter out because people couldn't integrate it as part of their lifestyle. um, those that took something like the sort of Mediterranean diet, overdoing all out keto, they were able to sustain that into the 5-year mark and stay healthy. But for me, the big take home is that don't put rubbish inside of you.
Yeah.
Don't get overly processed things, because even if you find a diet that works for you, the quality of what you put into you does matter. Like you can eat really, really terrible low carb foods, but there's also really, really good low carb foods. So and I think this is where it comes into that education here is key. And I must admit, I've done the nutrition thing now for like 6 months, and just those small changes and making better choices in a sustainable fashion has been really, really helpful for me. But yeah.
And I think it kind of goes on to the health, or like the fitness or nutrition coaches and fitness coaches too, is we have to know why we're doing what we're doing. Like we have to know it's going to take time for someone to see results. And there's this area of usually around the 3-month mark where we start to see sustainable, right? Like I'm sure I can help someone lose 20 pounds in 1 week. Just don't make me eat anything, but that's not health. That's not fitness, right? That's chasing an aesthetic or an outcome instead of actually wanting to live and thrive and feel better. That's what it's about. But that's the difficult conversation. That's the difficult thing to do, is attach someone to a habit and then say, if you do this for this long, this is what it's going to look like. It's going to take time, but you got to trust the process. And it helps if you're in a community of people that have been through it before too. But that's the other aspect of it that's really hard, is in the preventative area of health and fitness. You might never see what you prevented too.
Yeah. And I think, was it, you sent me that other breathing thing. And he also talks about the fact that you're making these changes, but you don't see what you're actually changing because it doesn't happen. And I think that in a consumer-driven, outcome-driven society is challenging. Well, you didn't do anything for me. Well, yes, we prevented all of these things happening, but it didn't happen, so you didn't see it.
Yeah, and that's the difficult part, is if we were living the way we're created to live, like in the blue zones, we wouldn't need a lot of things we have now, like even gyms or things like that. I'm deeply grateful for having gym and seeing people, but they're there for a reason, and it's adapted in this way to what we need this being, is because now we're putting out fires instead of looking at what is putting fuel on these fires. Well, it's the chronic poor habits that happened 20, 30 years ago that now we're trying to figure out why, when in reality, we're going to have to be patient and have delayed gratification, say, as the consumer, as the coach, and say, this is how we get there. So this is how we get to a blue zone. Because I know we've chatted about my legacy goal is to make Camrose into a blue zone. That's really challenging, because if that happens, I'm never going to see it, because I mean, someone has to live to 100 and something.
Yeah.
Right?
No, that's very, very true. Well, we'll be sort of walking down the main drag in our 4-wheel walkers, saying, "Oh, thanks, Matt. You created something all those years ago."
Well, yeah, and that's to say, if definitely can't do it by myself. So if anyone's interested in hearing this, talk to me about the blue zones. Talk to me about making Camrose a blue zone, because we can't get so caught up on getting it perfect. We just got, even just like a client comes in, we just got to start. They just got to start, right?
Yeah, and I think that's the big thing, is people are so scared of starting, but you just have to. And I think if I look back to when I started my sort of CrossFit journey, I was terrified because the general perception was the sort of CrossFit Games people, everyone's got their shirts off, throwing things around, making primal noises, and not caring about it, like how you do it or whether it's safe. And all you hear about is injuries and things like that. But at the end of the day, you start it and you realize, wow, these are actually really cool people of all different ages that are just here to really care for themselves. And it was quite a mindset change to realize that, and that it's not about doing 60 muscle ups. It's about doing what you can to do you better, and not the person next to you. You can cheer them on, but you don't have to be them.
No, I love that. That's so impactful. And the mantra for CrossFit is mechanics, consistency in those mechanics, and then intensity. Often people get it backwards, right? I hopped right into the intensity instead of realizing, just like anything else, it's going to take time. So I can't like, let's say I didn't work out consistently. I could deadlift 400 pounds before, haven't deadlifted in a long time, go into the gym, try to deadlift 400 pounds again. It's not going to be the same thing because it takes time and consistency to get there. And you mentioned that it's the community aspect. I think that's a really important thing too, is I know we touched on already, but the community aspect. And even going back to the food idea, you're passionate about food. And when Julius and I were in Italy, I noticed that they were drinking lots of wine and having high carb food. And well, even one of the Bluezones is in Italy, right? But they were in community around the food. They were appreciating the food. They were laughing. They were outside. There's so much more to it than just one thing.
And the big thing is they walked there and they walked back home. And I think that's one thing that we lack, is that during summer, we walk everywhere. Winter makes it a little bit challenging, but it is that meeting people at 5 o'clock for a drink is kind of what the Bluezone's all about, is making food and making wine around people, and not something that you do sitting at home in front of a television.
Yeah. And you mentioned about meeting the person who makes bread at the market and talking to them and having a relationship. It's funny because a memory popped up on my phone. Same thing, Julius and I were in Bologna area, and we're in Italy, and we're in this small little market. And on my phone, I have a memory of a video, and you see people just interacting, asking about food, and it's quiet. There's music going around. And if I compare that to a big store, you don't stop to talk to anyone. You just try to get out of there as fast as you can, do the self-checkout, and then go home. But we're missing the point, right? It's not just about trying to get through the next day. It's about being involved in your day.
Mm-hmm. And the worst is you don't know where any of it comes from.
Right. Like food.
Mm-hmm.
Yeah.
So it'd be really, really nice. And I know I get my lamb locally, and there's like the flour that I have now comes from High Level. But it would be really, really cool to be able to buy things locally and engage with people, and have an egg guy and have a zucchini person, and just just have that relationship around food as well. And I think that's something that would be really, really nice to do here.
Yeah. And I think that plays into the Bluezone idea too, right? Is making a consistent, small little market and it also supports the businesses, right? Like, yeah. And I think there's so much, like we can dive so deeply into this, and everything's so connected, right? Like, because there's purpose in that too. Like if you make bread and you're able to give it to someone, explain how it was made, get passionate about that, that's for that person too, right? Man, there's so much into this that I don't really know where to go next.
Yeah, no, then it starts getting into the whole, well, it's more than bread. It's a relationship transaction, and
Yeah.
it it's soul food, not just food.
Yeah. And I think it can become overwhelming too, right? Like this is where people struggle is like, I'm going to go 100% in. I'm going to work out 5 days a week. I'm going to eat 100% clean. I'm going to do this, this, and this. And then 2 weeks later, they've fallen off the tracks.
And they're miserable.
Yeah.
Yeah. No, it is about that sort of 80-20 splits,
Right.
and doing the things that you need to do, but also doing those things that you absolutely love doing. And passion and purpose are an essential part of actually getting you there. It's not just about making the right choices the whole time.
I think that's where we should go next is passion and purpose. And you can see it behind me. I pointed the right way this time. On there, it says, I want to help people live with purpose, pursue their passions, and use their gifts. That's meaningful, right? Even in fitness, we chase these markers. Like I want a six pack. I want to be this weight. I want to be this body fat percentage. Instead of actually chasing the process of working out. Same thing with our careers or our jobs. We're chasing this retirement, but what about the other 60 years leading up? Or no, that's not right. The math isn't right, but you get the idea, right? Like what about the other time? What about your passions? What about your purpose? Like you're made to contribute.
Yeah, it's definitely something that people forget is there's this survival element, and trying to get your RSPs and get the best thing that you can, so that one day you can start living.
Right.
Like I'll retire and then I'll do all these things. But if you're physically not able to do it, that's firstly a problem. But you're also then plodding along without passion, without purpose.
Mm-hmm.
And I'm very, very fortunate. I love what I do. I'm very, very passionate about providing good quality care in sort of all stages of life. I'm primarily focused sort of end of life, and that's what I enjoy doing. But I'm also passionate about everyday things like bread and food and wine. So, and that's what keeps me going right now. I'm a firm believer that you can't live for this endpoint. There needs to be something that gets you going now, and that gets you out of bed and gets you feeling excited about that specific day, not for that one day, maybe when I'm,
it gives meaning to your day.
Yeah. And that's one of the key Bluezone features, is that people have purpose, and not just an obligation.
Yeah. And that's another thing. There's a statistic, and don't quote me on this, but it was like 15% longer lifespan with just having a sense of purpose.
Mm-hmm.
Like simply just a sense of purpose. And I think we get confused what purpose is. Purpose isn't what you do, right?
No.
It's who you are and what you do. It's those little passions. It's an accumulation of all these things. So if someone's been in a career for a long time, you don't have to just leave it, but start to pursue the passions on the side. Maybe that'll pick up momentum. Maybe that will overtake this fear of pursuing it because it gives you so much life, because it's not about accumulating. It's about contributing and making impact with what you've been given.
Absolutely. And yeah, there are times that you absolutely hate what you're doing. If I'm at work at 1 a.m., I really, really hate it.
Right.
But, and it's not to say that every day has to be this passion driven like inspirational, motivational moment.
Right.
Yes, there are going to be moments that are going to suck, but you have to, I think it was Brene Brown that said, embrace the suck. You have
Yeah.
to be okay with the suck to be able to move through it and learn from it.
Yep.
And come out the other end and be excited about things again.
Well, yeah, embracing the difficulties, right? Like, because we're guaranteed of those. So we're guaranteed of hardships and roadblocks. But it's what you make out of them too, and acknowledging that you're not going to be absent from them. That you're not just able to be living on a beach for the rest of your life, because there's no meaning in that either, right? Like,
Yeah.
I'm sure that's where you can see some people, their health and fitness start to deteriorate when they lose this meaning.
Yeah. Yeah. But I think it's really, really challenging times right now for people to necessarily find that, especially when everything else is going wrong. Especially if you're someone who derives energy from other people. It's really, really difficult, and a lot of people are really struggling right now to get through that. But uh, as I said, I'm very, very lucky to work in a healthcare team. So that's my escape and my chance to socialize and be with people. Although I haven't seen the faces of any of my colleagues for a very, very
Right.
long time, because it's all masks, goggles, you know, and I haven't worn normal clothes in a really long time either.
Right. It's been, and we chat about that too, is like, it's really hard in the healthcare system right now. But you guys still have, obviously, you have a sense of purpose in it. Like, even if it's hard, there's still a sense of purpose and you have that connection, right? So we're currently running a mindset, fitness, and nutrition program for nurses,
Mm-hmm.
because we noticed that, well, they have a sense of purpose, right? Like, it's hard and they're having this connection. So on the aspect of the flywheel, what are they missing right now? Because they're busy, they're tired, but that doesn't negate the need to still prioritize those things, right?
I think it's that whole self-care aspect of it. Bear in mind, they're a profession of caring,
Right.
but that care is external.
Mm-hmm.
They're caring for other people,
Yeah.
um, and often at great sacrifice to themselves. Um, they injure themselves. They don't pee for hours on end. They stand. They miss breaks, all in the name of caring. And I think it happens in every single profession. Is people are not taking self-care moments, because what society has told us now is that you'll only be successful if you don't care for yourself, if you put everyone else ahead of you, because the moment you take a moment for yourself, you're selfish,
Mm.
um, and you're not what we deem to be successful. You have to wake up, you have to work out, not for you because you have to look great the whole time. You have to go to work, you have to raise kids as if you're not working, you have to work as if you don't have kids.
Mm.
Um, and you have to be this perfect person the whole time. And at the end of the day, you have trouble sleeping. You're really, really struggling, because self-care became an uncool thing to do.
Mm.
And we're now slowly starting to get across that there are these self-care moments that you have to take. And if you don't care for yourself, if if you don't fill your tank, um, you're not going to have anything to give to anyone else, which is why I'm very, very happy that you're doing something for a group that really in 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 the last year have given more of themselves than any physician could have ever hoped. I mean, there were some nurses during the height of our outbreak that did 18 days of shift work in a row. that's 18, 12-hour shifts, some of them extending to 16 hours of work every day, caring for other people and just taking no time for themselves at all.
Yeah. That's tough, where you can't pour from an empty cup.
Yeah.
Right? And then you start to live in this chronic cortisol state, right? Like it just, which is not a bad hormone, but it too much of it is not.
It's bad hormone in the long run. I mean, it's anti-sleep, it's pro-diabetic, it's really a chronic cortisol state is not really where you want to be. But learning to take those self-care moments, like box breathing or whatever you want to do, it really, really helps with that. But you have to know that it's okay to do a bit of self-care.
100%. And even if it's just, we have a mindset course and the first thing we do with someone is just take 60 seconds to yourself. I don't know if you can hear my dog barking, but I'm going to have to pause for a second and we'll splice this in, because my wife is actually a nurse and she's sleeping for her night shift.
And another night shift.
Yeah. All right. Self-care is so important, especially for people who are in this chronic state of stress. And stress, I think we have to remember that stress isn't bad, right? We stress our body when we work out, but recovery is vital. And recovery in the different aspects of the flywheel are going to look different, right? Like you have to recover overcompensation or supercompensation, sorry, right? You have to elicit a stress and then you have to recover enough that slowly over time it gets higher and higher. But if you're continuing to beat yourself down and working out too much, because even if it's stress from one aspect to another aspect, it's going to gain over time.
Yeah.
Yep.
Very true.
Okay. Passions. So we're talking about passions too, right? Like purpose. And what are you passionate about?
So many things.
That's right.
No, because I try to think about it beforehand, and I was like, what am I truly passionate about? What excites me? And I think there's three big things. Firstly, I am passionate about people having that aha moment with their health, where they realize that we've reached a point that they need to change something, and it's working with them and teaching them about what's going on that brings me great joy. The second thing is human comfort. I'm absolutely passionate about people having a good quality life, a good quality death, and really seeing the family transition into that. And that's something that COVID's sort of made a little bit challenging, but that recognition that people's life journeys are not a solo effort. It's about people and helping people navigate those difficult life moments in their family context. And then I'm really, really passionate about carbohydrates.
Oh yeah.
Like super passionate about carbohydrates. I love bread, I love cakes, I love cookies, I love all things of that sort of type, and I love making them, and I love giving them to other people. So I'd say those are my three big passions.
Well, and then the last, like, talk about lover of carbohydrates. Like, you've been in our nutrition program and you've seen success, and you haven't had to, like, you can still have those things, right?
Yeah, I just now give away a lot more than I eat, which really fuels me anyway. So that's fine.
Well, I appreciate it because we've had some, and I'm passionate about eating other people's passions.
Yeah, no.
So I think we kind of covered it, but I think we covered it in the sense and then helping people understand it's not a simple problem, but it's a simple problem, right? Like what I mean by that is we're looking for this magic. We're looking for this thing that's just going to fix it like this. When in reality, you just have to look at 30 years prior and say these all are contributing. These all matter. Every aspect matters. You can't compartmentalize individual things. Like when I work out, it affects my purpose. When I'm living with purpose, it affects my spiritual life. Like they're all so intertwined. But it's having the foresight and the patience and enabling yourself to live into that delayed gratification and growth mindset to start today.
Yeah. You have to allow yourself to be human. Humans are social. Humans need food. Humans need purpose. And without allowing yourself to be that, you're really going to struggle.
Yeah. Can I just say how excited I got when you said walking down Main Street with our walkers? I keep picturing that, like, and then a banner that says Blue Zone, and you just walk
Yeah.
down. Yeah.
Well, the big thing is maybe we won't even need four-wheel walkers. We'll be so good. We'll still be spry at 103.
We'll be skiing the trails, which I need to start doing. We'll be mountain biking. We'll be doing all these things that we are created to do. And that's what I'm passionate about, is people to stop wasting their gift of time. We're not guaranteed of tomorrow. And I think this has really showcased that. We can't live with 100% safety. If we try, we're going to lose the actual life, right? Like, and this is a hard topic, but we are all guaranteed to pass on.
Yeah.
We don't know when, but stop living in the yesterday and stop worrying about tomorrow and be present and start contributing and enjoying the good things.
No, absolutely.
So now it's the closing questions.
Ooh.
Name one thing on your bucket list.
At this point, it's just traveling again. I just want to get out.
Hey, you're passionate about traveling too.
I'm really, really passionate about travel, and we've sort of linked our food and travel journey by trying to hit the world's top 100 restaurants. The only thing is, it's something that you'll never be able to do. Sorry, it's the top 50, because they tend to change every year. So we've done, I think, 3 of them, but it's something that I definitely want to do. And a lot of this is going to involve going to Japan, which I think at this point is something that I really, really want to do, and something that we were going to do, but then COVID, right? So yeah. So absolute bucket list would be hitting the top 50 restaurants in the world, but you'd have to do it in 1 year, because they'll just change, right?
Make it happen somehow. I don't know. Which 3 have you done?
We did Alinea in Chicago. There's a place in South Africa called Test Kitchen, and then we hit one of them in the US. Another one in the US. I just can't remember which one it was, but it's they're really, really memorable experiences, and we're all about trying to find cool food places wherever we go. We're recently in Portugal, and in Lisbon there was a place I think called Market or something like that, but it was these 2 guys that cook in the tiniest kitchen you've ever seen, but the idea is that you've got 10 guests sitting around a common table and you're just eating food, but you're talking and exchanging stories. And unfortunately, the night that we were meant to go, the other group that was meant to be there, one of them got sick and they had cancelled. So it was just Badine and I were these two chefs that made us food. It was such an incredible night. But it would have been really, really nice if we had that social sort of context. And we used to do something called secret eats, where you go to a random place that you only find out the day before about, and you meet and socialize with a whole bunch of people you've never met before. So it's all that food and people and wine that makes me very happy.
Purpose, man.
Yeah.
So you could say a common theme from that separates the top 50 and from the three you've been to, what would it be like that separates it from the rest?
Innovation, a realization that even simple things done really, really well can be absolutely incredible, and experience. They all do more than just food. It's the experience and the theater that goes along with it. And Linea was by far the most theatrical of them all. It was like a food performance. You wanted to sort of applaud because it was really, really special.
Well, yeah, you touched on doing the common like really well. That's the definition of virtuosity, which we talk about in CrossFit. Like people doing the common uncommonly well. It's not about complexity all the time. Or you said it's not complex, right? Like, and you probably found in the gym, the simplest workouts are sometimes the hardest and the most effective. And that goes back to someone just starting their fitness journey. Is it doesn't have to be complex. It doesn't have to be this macro counting, calorie counting, or super tough, difficult workout thing. It's just starting simple.
Yep. No, absolutely.
So the goal is to help people. If you could give one piece of wisdom or advice that you could think would help someone in any aspect, it doesn't have to be fitness, what would it be?
Start something. The key is to just start something new, start something different. But there's this commencement inertia that people have, that they're too scared to start something, to try something different. So mine would be start something, because I wouldn't be part of this team if I didn't start something, and I didn't start something that I was uncomfortable about.
Yeah, you have to get a little bit uncomfortable, right? There's usually some good stuff.
Yeah, you won't find me dead swimming in your cold water, but I'll get it. I'll get uncomfortable in other ways.
Yeah.
Thank you very much.
Yeah, you're welcome. Is there anything new that you're starting? Like, are you trying something new?
Yeah, I'm trying to start meditating, which for anyone that knows me is I have the attention span of like a 2-year-old. I'm constantly moving. I'm constantly thinking about things. I'm listening to everything that's going on around me. So just learning to quieten myself is going to be difficult. So we'll see how it goes. It's not going very well.
No,
but that's fine.
Exactly.
We'll see, and it's something that people dedicate their entire lives to and eventually do well. And I'm not going to get to the point of a Buddhist monk, but I just want to be able to take that time and just not engage with the world for a little bit.
Yeah, sometimes it's not about putting a label on it and saying I have to be good at it. It's just intent of doing it and starting, and it might lead to.
And it's time that's for no one else. It's time that's for me. So, that's that me time part.
Yep, I really, really like that. And that's the first thing we do with our mindset clients is just start with 60 seconds. And if you have thoughts going by, if you get distracted, if whatever else, it doesn't matter, but you're being intentful about creating that space. What is the most positively impactful thing someone has said or done for you?
said thank you.
Mm.
I thought about this a lot, and especially in a service industry, people don't get thanked, or they get thanked superficially. That whole, oh, thank you, bye. It's become so part of our way of speaking that there's not the same sincerity in thank you. But when someone truly looks at you and says thank you, it feels incredible. And it's definitely something that we all need to start doing more of, is thanking people, and thanking people for their time, thanking people for even doing what we perceive as their job or what they're meant to do. But that actual appreciation of the relationship transaction, of thank you for spending your time with me, thank you for doing this for me. So yeah, I have a few thank you cards that I get from various families, and when I'm really, really low, or I've had someone that's been like horrible to me, to just go back and see them is like, okay, I am valued. I did make a difference. So yeah,
I think that's really powerful. Yeah, thank you for that. Well, I know my love language, the top one for me is words of affirmation. So that resonates really.
So is mine. So that's why thank you means so much to me. Yeah. I'm an absolute words of affirmation person, that tends to give love with acts of service. And yeah.
So acts of service is your second one then?
Well, it's my primary giving language.
Okay.
But it's quite interesting. Badine and I were speaking about it, and we realized that you learn your giving love language that you default to when you don't know what to do for someone. You default to what your mom or your dad had as their sort of love language. So it's one of those that you fall back on, and it can often be difficult, because if your spouse doesn't share that same love language, you tend to go up the wrong way. Badine is not an active service person, so my default setting just does not work. So you have to work on that. But yeah,
I know we don't have too much time. We don't want to take too much of time, but that topic, and me and Jaleesa went through the 5 Love Languages book this year, and it's funny because I am in this order: words of affirmation, quality time, physical touch, acts of service, and then gifts. And I need to caveat this by saying I love gifts, but I was 0% gifts on this. And Jaleesa was, I believe I should know this, it's either gifts or acts of service first. And her quality time is the lowest, like it's 3%. So we talked about, like, hey, it's just an opportunity to learn more. But you do start to see, and even what do I default to as a person? Like, so what does Jaleesa default to as an act of love? Because then that gives me an indicator of, oh, that's probably how I should love her.
Yeah. No, it's a very, very intriguing avenue to go down in a marriage, is to try and figure out what everyone wants and what everyone needs. And we just did Andy Stanley's What Happy Couples Know.
Yeah.
And that was also quite an interesting way of seeing things, and it's definitely changed how you view things. So I really love all Andy Stanley's things, and his I will shamelessly plug What Happy Couples Know.
Well, and I honestly, me and Jaleesa just watched that 2 nights ago. We're going through the series thanks to you, so thank you for that.
Yeah,
excited to, but yeah, we have to work on fitness in every aspect. And that can be the closing thing is there's marriage, like there's relationship fitness too. Purpose fitness, like what's the opposite of fitness? It's sickness. And usually it takes a long time for something to get to one end to the other. If Jaleesa's love language is gifts, I can't expect to give one gift a year and that to cover it. Just like I can't expect to go work out once a week for 3 hours and that to cover it. No, it's the consistent small habits over time, good or bad, that manifest into what you look like in 10 years or what your relationship looks like or where you are in a career.
No, absolutely. I definitely think there needs to be this whole culture shift to doing small things consistently. And the only way to do that is to be part of a team or part of a group that shares that vision. And I think that's how I found a place with your team and with your group, is that we share this vision of what health is, what wellness is, and the physical or virtual space to make that happen.
Yeah. And I guess
so thank you, man.
Yeah, you're welcome. If I could plug that, if you guys, this sounds attractive to you, a place like this, please reach out. It'll be in the show notes, our website. And then also, if you want to talk to Louis, fantastic guy to talk to, where can we find you?
Outside with the dogs a lot of the time.
Okay.
With you guys. And then unfortunately, professionally, you'll have to be really, really sick before you see me. Yeah. So you really don't want to find me there. But else, yeah, I'm outside with the dogs or trying to find a new flower.
Flower, I love that. Are you on Twitter, right?
I am, but I'm not very, very active. I primarily use it to follow a whole bunch of other people. Because there's this real big medical Twitter movement. I don't tweet anything, but there's far smarter people saying really, really great things. So yeah, no, I'm very, very passively involved with social media. I'm a consumer, not a creator.
Okay, noted. Okay. We'll find you out in the valley with your dogs.
Exactly. Cool.
Well, thank you so much, Louis. Really appreciate it.
Thanks.